Friends, so in this video I am going to discuss you about what is thrombocytopenia, and second, what are the types of thrombocytopenia, and third, pathogenesis of ITP. ITP, that means Immuno Thrombocytic Purpura. And also I am going to show you my written portions, what I have written on the basis of the explanation given. So please watch the detail. I'm going to discuss what is thrombocytopenia. Now, you should know that this thrombocytopenia is a pathological condition. So, first of all, you should know a little bit about normal physiological condition. So, friends, now see this diagram. So, if you see that, you can see that there are blood vessels are seen like arteries, veins, and capillaries. And you also know that inside these blood vessels, so here blood cells are there. Now see that there are three types of blood cells: RBC, these are also known as erythrocytes; WBC, leukocytes; and then platelets. RBC, that means red blood cells, and WBC, that means white blood cells. And you can also see that there are two types of leukocytes, that means leukocytes again divided into two categories. So here granulocytes and agranulocytes, and in granulocytes eosinophils, neutrophils, and basophils come, and on agranulocytes monocytes and lymphocytes come. So there are three types of blood cells: erythrocytes, leukocytes, and platelets. And these leukocytes divide into granulocytes and agranulocytes. And you should also know that all these blood cells, they are present in a normal range. That means that their concentration or the number of these blood cells is in a normal physiological range. It is not very less nor very high. It is in a normal range, so that all the physiological functions of the body are done correctly and there is no problem. So this is a normal physiological condition. Now see this diagram. So this diagram shows the normal number of red blood cells, white blood cells, and platelets in the blood vessel. So this is a normal situation. Now see this diagram. So if you see this diagram, so you can relate that the number of platelets is reduced, whereas the number of red blood cells and white blood cells normal. Now, and that pathological condition that occurs due to decrease in the number of platelets, and that is known as thrombocytopenia. And you should know that what is a normal range of platelets in the body? It is 1.5 to 4 lakhs per microliter. So thrombocytopenia occurs when the number of platelets is less than 1.5 lakhs per microliter. And excessive bleeding disorder or thrombocytopenia occurs when number of platelets is less than 20,000 per microliter. So this is the main definition of thrombocytopenia. So see friends, what I've written there in blood vessels. So here blood cells are present, and types of blood cells are, so here number 1 is RBC, erythrocytes, number 2 is WBC, leukocytes, and number 3 is platelets. And also this is a very important point, that all these blood cells are produced by the bone marrow present inside a long bone. And about this part I am going to emphasize and focus more on describing about the types of thrombocytopenia. So this is very important. Now here normal range of the following blood cells: number 1 RBC, for adult males it is 5 to 5.5 million per cubic millimeter, and for adult females 4.5 to 5 million per cubic millimeter, and for children of adolescent 4 to 5.5 million per cubic millimeter. And here, and about WBC it is 4,500 to 11,000 per microliter, and about platelets is 1.5 to 4 lakhs per microliter. So these are the, so here different, so here that is normal ranges of the following blood cells. So RBC, WBC and platelets have different normal range, and they have different number in the blood vessels. That means their number varies. That means the number of RBC is greater than that of platelets, and also there is a number of WBC is lesser than that of platelets. So all these are the normal ranges. And also see, now I have also shown you about the types of WBC. So here WBC is divided into two types, granulocytes and agranulocytes. And under granulocytes, erythrocytes, leukocytes and platelets come, and under agranulocytes, monocytes and lymphocytes come. These are all the normal processes that I have discussed. And now see, about thrombocytopenia, see that is thrombocytopenia. It is a pathological disorder occurring due to the decrease in the number of platelets. And as you already know that the normal platelet count ranges 1.5 to 4 lakhs per microliter, and this thrombocytopenia occurs when the count of platelet falls below 1.5 lakhs per microliter, and severe, that is bleeding, occurs when this count is even less than 20,000 per microliter. Now I am going to discuss what are the types of thrombocytopenia. But before knowing the types of thrombocytopenia, that is, you should know a normal physiological process. Now, see that this is a long bone, and in this long bone, that is, bone marrow is found. Inside this long bone, that is, bone marrow is found, and this bone marrow produces all the three types of blood cells. That means bone marrow produces red blood cells, a WBC, that is white blood cells, and platelets. That means platelets are produced by bone marrow. So this is a normal physiological process, and all these blood cells, they are in a normal range. There is no bleeding disorder, anemia, or that is weak immunity occurs, because all these blood cells, that is, stay in a normal range in a normal healthy people. Now, so let's discuss about the types of thrombocytopenia. So you should know that there are two types of thrombocytopenia: megakaryocytic thrombocytopenia, and the next one is amegakaryocytic thrombocytopenia. Now, first of all, let's discuss about amegakaryocytic. So therefore, as you already know that thrombocytopenia, that means decrease in the number of platelets count below the normal range. Now, when this thrombocytopenia is associated with the bone marrow defect, then that thrombocytopenia is known as amegakaryocytic thrombocytopenia. That means in this case, bone marrow has some defect, and due to that defect, it is unable to produce the required number of platelets. So this is the amegakaryocytic thrombocytopenia. Now let's discuss about megakaryocytic thrombocytopenia. Now, so in case of megakaryocytic thrombocytopenia, bone marrow is normal. That means bone marrow is able to produce the required number of platelets, but there are some autoantibodies made against these platelets, and these autoantibodies destroy the platelets which are produced by the bone marrow. As a result, the number of platelets is reduced, and also the thrombocytopenia occurs. And that thrombocytopenia that occurs due to the decrease in the number of platelets by the formation of autoantibodies is known as megakaryocytic thrombocytopenia. That is. About types of thrombocytopenia, I have written that. So here, types of thrombocytopenia, the first one is the megakaryocytic thrombocytopenia, and the second one is the amegakaryocytic thrombocytopenia. That is, megakaryocytic thrombocytopenia occurs due to the formation of autoantibodies against platelets, and in this case, so here bone marrow is not affected. Why? Because the bone marrow has formed the required number of platelets, but these autoantibodies, they are destroying the platelets. Now about amegakaryocytic thrombocytopenia, see that. So here amegakaryocytic thrombocytopenia occurs due to the defect in the bone marrow. So in case of amegakaryocytic thrombocytopenia, bone marrow is defect, and as a result, the number of platelet count is reduced, and then here thrombocytopenia occurs. I'm going to discuss you about ITP. ITP, that means Immuno Thrombocytic Purpura, and also the pathogenesis of ITP. So first introduction that I want to give about ITP is that is ITP, Immuno Thrombocytic Purpura, is a megakaryocytic thrombocytopenia. That means in this case the bone marrow is normal. It produces a normal number of platelets, but autoantibodies made against the platelets, and these autoantibodies destroy the platelets. As a result, immunologic destruction of platelets is done, and here platelet count is reduced and thrombocytopenia occurs. So this is the basic information of ITP, Immuno Thrombocytic Purpura. Now you should know that there are two types of ITP, acute ITP and chronic ITP. Now here, so first of all let's discuss about acute ITP. So here that is acute ITP occurs in children of ages 2 to 6 years. Now also a very important part about acute ITP is that is acute ITP occurs after infected with a virus. Now I am going to explain the pathogenesis of acute ITP, and after explaining the pathogenesis of acute ITP, you can easily understand why this acute ITP occurs after infected with a virus. So let's begin the pathogenesis. So that human body is first infected with a virus, then the viral antigen so here enters the body. Third, that is on the basis of the viral antigen so here antibodies are made, and these antibodies do cross reaction with the viral antigens, so therefore that is antigen antibody reaction done with the virus particles. Okay, but that these antibodies also do that is cross reaction with the platelets. Since these antibodies they are that is trying to destroy the body's self tissues, so therefore these antibodies are known as autoantibodies. Now due to this cross reaction of these antibodies with the platelets, there is again immunologic destruction of platelets is done, and as a result platelet count is reduced and thrombocytopenia occurs. So this is the main basis of pathogenesis of acute ITP, that is infected with a virus particle, antibodies made against the virus particle, but these antibodies do cross reaction with the platelets. Third, as a result platelet count is reduced and here thrombocytopenia occurs. Now let's discuss about chronic ITP. Now here that this chronic ITP is so here occurs in adults. Now here again pathogenesis of chronic ITP. So in this case there is no viral infection is done. So here in this case, so here autoantibodies made against the platelets, and these autoantibodies of platelets so here do the so here immunologic destruction of platelets, and as a result thrombocytopenia occurs and is an anti-platelet autoantibodies. Now here in both acute and chronic ITP, so here negative regulatory signal goes to the bone marrow, and due to this negative regulatory signal so here that is bone marrow so it tries to increase the platelet count. Now about this negative regulation of to bone marrow I am going to explain you by seeing a diagram or a written portion. Then the negative regulation on the bone marrow. Now as you already know that here bone marrow so here produces platelets, so this is a normal thing as you already know. So see that what happens in so in megakaryocytic thrombocytopenia, as you already know that in megakaryocytic thrombocytopenia that is the platelet count is reduced but the bone marrow is effective, and this platelet count are reduced. Why? Because of the autoantibodies which are produced, and these autoantibodies so here destroy the platelet, so therefore the platelet count is reduced. So in response to that due to megakaryocytic thrombocytopenia, that is a negative regulatory signal goes to the brain, and due to that negative regulatory signal, that is the bone marrow is stimulated to increase the platelet production. So this is the main reason for a negative regulation of the bone marrow. So see what I have written. See, so here that is negative regulation to bone marrow. So here that due to excessive destruction of platelets, a negative regulatory signal goes to bone marrow, and this leads to increase in platelet production of by bone marrow. So this is the case of acute ITP. So here similarly in the case of chronic ITP also, that is negative regulatory signal goes to the brain, and this stimulates to increase the platelet production by bone marrow. So that is written. So here ITP, that means Immuno Thrombocytic Purpura, is a megakaryocytic thrombocytopenia, and here that is a full form. So here Immuno Thrombocytic Purpura. So as you already know, that is megakaryocytic thrombocytopenia, that means platelets are destruction done by the autoantibodies of class IgG. So here autoantibodies, so just remember, and here, and in this case, so here bone marrow is not defective, and here types of ITP, acute ITP and chronic ITP. And acute ITP, so see that it occurs in children of age 2 to 6 years, and here, and this acute ITP occurs after infected with a viral antigen. And by so here that is studying the pathogenesis, you can easily relate how this acute ITP occur after infected with a viral antigen. So now that is pathogenesis of acute ITP. So first, that is viral antigen enters the human body, and with response to the IgG antibodies form against viral antigen, and these IgG antibodies do cross reaction with platelets, and due to that cross reaction with platelets, that is immunologic platelet destruction is done, and due to that immunologic platelet destruction, so here platelet count is reduced, and due to decrease in a platelet count, so here thrombocytopenia occurs. So once again I am going to revise. So here viral antigen enters the human body, IgG antibodies form against viral antigen, and these antibodies do cross reaction with platelets, and this immunologic platelet destruction done, and platelet count is reduced, and thrombocytopenia done. And this is the negative regulation to bone marrow. So here that due to excessive destruction of platelets, a negative regulatory signal goes to the bone marrow, and this leads to increase in a platelet production by bone marrow. So now again about the chronic ITP. So see that, so here it occurs in adults mostly. So here, and now pathogenesis of chronic ITP. So here anti-platelet autoantibodies form, and this immunologic destruction of platelet done. Why? Because that these anti-platelet autoantibodies, that they cause this immunologic platelet destruction, and again platelet count is reduced, and thrombocytopenia occurs. And again negative regulation to bone marrow. So here due to excessive platelet destruction, so here platelet production increases due to negative regulation in the bone marrow. So these are all about the ITP and pathogenesis. So friends, so that's all about today's video. So in my today's video, I explained you about what is thrombocytopenia and what are types of thrombocytopenia, and a pathogenesis of ITP. That means Immuno Thrombocytic Purpura. So in my next video, that is I'm going to give you that explain about the laboratory diagnosis of ITP, and also what are the clinical features of ITP. So please stay tuned.